Good morning, and thank you for joining us for All Things Heart. I'm Alexis Del Cid. Right now, we're working hard on bringing you some incredible new episodes for Season 6, which begins this fall. Until then, we will air Encore presentations every Thursday at 8 a.m. right here. So sit back, relax, and enjoy this Encore presentation of All Things Heart. A new mom goes from spending a morning snuggling with her baby to the emergency department and a stunning diagnosis. On today's All Things Heart, the treatment and the changes she made to her life, personally and professionally, that mean you might just see her taking care of your heart one day.
From the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. Today's guest is no stranger to hospitals. Our patient today, Kara Burns, also happens to be a nurse practitioner here at the University of Kansas Health System. Yet even with all of her medical knowledge and her training, she still wasn't prepared to learn the reason behind her intense back pain.
Trying to decide whether we need to put her on dialysis or not to help get the fluid off.
Kara Burns is a nurse practitioner in the Heart Center at the University of Kansas Health System. For Kara, coming to work here was personal.
I was actually sitting in bed with my husband drinking coffee with my 3-month-old between us, stretching and having an abrupt onset of horrible back pain right between my shoulder blades.
At just 39 years old, Kara was having a heart attack.
A heart attack was the farthest thing from my thoughts. Even being a nurse practitioner, I didn't think it was a heart attack. I had no risk factors, no family history of heart disease.
She had emergency heart surgery and learned her attack was SCAD, a spontaneous coronary artery dissection.
It's the inner lining of the artery tears and then basically just closes the artery down. So it's like a one-way valve, so you just can't get blood through.
The event changed her life, both personally and professionally, for this mother of 4.
In my head and in my heart, I knew I needed something else to see patients that not necessarily have the same condition as me, but ones I can definitely empathize with.
If working in cardiovascular care was the goal, Kara knew there was no better place than the Comprehensive Cardiac Center at the University of Kansas Health System. Not long after changing jobs, Kara changed doctors. She's now a co-worker and a patient of Dr. Paola Roldan.
Which is nice because she's a female, and I think females sometimes just understand females a little bit better than men understanding women. So it's been a good thing.
Kara hopes her story helps others.
I think being the biggest advocate for your own care is the most important thing. Seek out that care you need so that you get the answers that you're looking for.
So we're joined by Kara Burns right now, and her doctor and her co-worker, Dr. Paola Roldan. Dr. Roldan is a cardiologist here at the health system. She's also your cardiologist, yes, which is so cool to have this dynamic. Kara, this all starts with you holding your baby that's 3 months old,
yes,
when you feel this intense searing back pain. What happened next?
I was actually laying in bed or drinking coffee in bed with my husband, and had this pain just hit me out of nowhere, and I jumped up out of bed trying to find a more comfortable position and just never could, and finally had my husband, I decided we needed to call the ambulance because I just could not get comfortable and it was getting worse. And
did you think, pain in my back, there's something going on with my heart?
Absolutely not. That was the farthest thing from my mind. I have no family history of heart disease, especially early heart disease. That was the farthest thing from my mind.
So you get to the emergency department, and Dr. Roldan, we're going to get to you in a moment, but I want to recap what happened with Kara. You get to the emergency department, you're having a heart attack, and you're diagnosed with something called SCAD, spontaneous coronary artery dissection.
Yes.
Were you familiar with what SCAD is?
I had worked in the cath lab when I was a nurse and had seen a couple instances of some dissections, but never spontaneous. They had always been induced by something else. And so I honestly had never really heard of it, even in all my years of cardiac nursing.
I want to bring Dr. Roldan in. Dr. Roldan, can you talk to us a little bit about what SCAD is?
Yes, absolutely. So SCAD is, as you mentioned, spontaneous coronary artery dissection. And what that means is, so there's arteries that surround the heart. There's kind of three main arteries. And within those arteries, there's 3 layers. And what happens is there can be bleeding within the layers of the arteries, or there can be a tear that results in bleeding within those layers. And because we're thinking of a lumen, when there's bleeding within a small area, that can cause that artery to occlude and cause effectively a heart attack. Wow. So there can be kind of different types of spontaneous coronary artery dissection. The biggest thing that differentiates them is whether or not there was a tear that led to the bleeding within the layers, or if there was just spontaneously bleeding within the layers. But as Kara alluded to, it's not caused by trauma, it's not caused by a catheter being within the artery. It's truly, as it's defined, a spontaneous coronary artery dissection.
We're so glad you're here today. That sounds so frightening.
Yes.
This was 10 years ago.
10 years ago in May.
So your son, what does he call himself now?
He calls himself my heartbreaker. He knows the story of things that have happened and seen the pictures, and so he calls himself my heartbreaker.
And you're feeling
wonderful. I feel
totally
great.
Fine?
Yeah, I feel great. Probably better now than I ever have.
So I just want to ask you more specifically about this pain. On a scale of 1 to 10, it must have been pretty bad.
It's probably been the most intense pain I've ever felt.
Where was the pain located?
It was directly between my shoulder blades is where I felt the pain, and and I also I didn't really, I think, have the chest pain, but I had some shortness of breath, and I got very sweaty and clammy, kind of, I guess what those would be more of a typical heart attack pains, but my pain was all in my back.
And still, as a medically trained person, heart attack isn't on your mind.
Nope, not at all. It was not. It was the farthest thing from my mind.
Thank God that you and your husband got you to the ED. How long was it between when you felt that pain and you arriving in the ED?
It felt like forever. I think it was probably about 20 minutes or so. We did call EMS to come, and so they scooped me up and took me much quicker than I would have if my husband would have taken me. But it was probably about 20 or 30 minutes between my pain and when I hit the emergency room.
Dr. Roldan, when we talk about time being critical in successfully treating a SCAD incident, what would have happened if Kara had tried to wait longer?
Yeah, I'm really glad that Kara listened to her symptoms. So most patients, like she's alluding to, do have some type of symptoms because, again, they're experiencing acute coronary occlusion. And so they typically experience the typical anginal symptoms, which is chest pain, neck pain, back pain, clammy, nauseated, some of those symptoms that you might experience with a heart attack. And time is of essence because, again, heart attack, we usually say time is tissue. So the longer you wait, the more myocardium damage there is. And dead myocardium or infarcted myocardium can cause arrhythmias. We see that a lot in of our heart attack patients and some of our SCAD patients.
For our viewers quick question, just can you explain to our viewers without medical background what is myocardium?
Yeah, heart muscle. Good question.
Okay. Easy. Okay.
Yep, so time is tissue. And so arrhythmias can happen. And then if we wait too long, the heart can get weaker over time and you can come in profound shock. And so I'm really thankful that Kara listened to her symptoms and that she told someone about them and didn't brush them off as, it's okay, I'm fine, I just had a baby, I don't want to go to the hospital. I'm really thankful she went to the hospital.
I could see someone maybe thinking they threw their back out. Yeah. And that is excruciating.
Yeah.
And then you decide you're going to not move and wait it out. And that would be such a horrible thing to do in this case. We have some images that could help our viewers understand what happens when someone suffers a spontaneous coronary artery dissection, or SCAD. Now, Dr. Roldan, when I look at these, I really, my eyes can't discern what I'm seeing here. Can you explain to us these images?
Yeah, of course. So I wish I could show my cursor, but if we look at the top left corner, you can see this is the main pipeline or the main coronary artery. So we think about the left main coming off right where that A is, and then it bifurcates into two main arteries. So that's the left anterior descending artery that's on the top of the screen. And then coming down, we see the left circumflex artery. And as you can see here, with experience, you can tell that these arteries are overall normal, apart from where there's this bracket sign. And as you can see, this artery looks normal up until that bracket sign, where you start to see significant narrowing of the arteries and tapering of the arteries. And that's typically...
Go on, sorry.
Oh, no, it's okay. I was just going to say that can be a typical tall tale sign when you see normal arteries that don't have a ton of plaque buildup, and then you see an acute tapering or narrowing of those arteries after, again, seeing normal arteries without atherosclerotic disease or plaque buildup disease.
Does the heart attack cause the SCAD?
The SCAD causes the heart attack.
The SCAD causes the heart attack. And then I've got to ask about the warning signs. Are there any advanced warning signs, or does it always happen suddenly, like in Kara's case?
Yeah, so it happens typically suddenly.
Whoa.
That's because, again, it's a tear, or with or without a tear, and then the spontaneous bleeding within the artery, and it's a fine luminal space. So not much bleeding causes an occlusion.
So Kara underwent an emergency procedure after she was diagnosed. What is the procedure that was done on Kara?
Yeah, and so I think in Kara's case, there's different approaches. Typically, when we see spontaneous coronary artery dissection, if the person is experiencing enough blood flow, we typically don't intervene, meaning we don't place stents, we don't go for bypass surgery. However, I think in Kara's case, there was significant occlusion and reduced pump function and significant troponin elevation. And so in that case, the team over at, I believe it was Overland Park, decided to intervene and place a stent. So Kara did have stents placed.
When it comes to your health situation, Kara, one of the most jarring things to hear as a woman to woman is that you had no risk factors. You had a new baby. You are also very healthy. You work out, eat right. From your perspective as a nurse practitioner, is it common to treat women for situations like this who don't have any of these pre-existing health conditions or predispositions like you?
I feel like it's becoming, I guess, a little more well-known, and women, especially women who don't have many risk factors. I think imaging is getting better, so the diagnosis is being made more frequently. So I think it was a pretty infrequent or rare diagnosis, and now I think with imaging improving and just the awareness being out that this is a major cause of young women's heart attacks,
right.
I think more and more women are being diagnosed with it.
Because we have better awareness and more resources available for women.
Yeah.
So do you treat women who've had the same thing often?
I've met a couple through work, and I've also know that there's quite a few actually in Kansas City that I know from a survivors group. So there's more around than what we think there are. So
do you ever tell your patients about your experience?
I don't frequently, but I think when I do see younger women who are struggling with whatever diagnosis they have in terms of a cardiac diagnosis, I feel much more almost obligated to share their story, especially if they're struggling physically or struggling mentally and trying to balance life and children and work. And, that because I suffered a lot of sadness and depression afterwards, and that it does get better, and medicines do help, and to trust your gut and be your own advocate if you know that something's wrong. And I do feel almost obligated to share my story with the younger women especially.
It's such a gift to share that. And gosh, you are busy with 4 kids. You had a newborn baby at home. What do you think causes the sadness after something like that? I
think it was, the biggest thing was that it was just my life wasn't what I thought it was going to be. I had heart damage afterwards, so I had trouble climbing the stairs to take him up to the nursery, and that was really hard for me. And my husband was fabulous and picked up all my slack, and to this day, 10 years later, he's still the one that puts my son to bed every night, because that was just the practice we got into after my heart attack. So those things I don't think will probably ever change, but I think just with some time and starting to feel better, and I lost such trust in my body, thinking I was young and healthy and at the a good point in my life. And so it took some time between cardiac rehab and time and medicine and good doctors to just help me regain that trust in my body, that I could get back to a normal life.
We talk to so many people who've survived scary things, and they talk about the betrayal they feel at their body, and then afterwards that anxiety of wondering, is another shoe going to drop?
Right.
You feel so fragile. Dr. Roldan, is Kara at risk for another event like this because she already had one?
Yes, so Kara is at higher risk because of her primary event that she's had. It's an uncommon, I guess I should also say, it's not a common cause of heart attacks. Typically, looking at registries, it accounts for, less than 1% to 2%. And there's some other additional risk factors that we could talk about, but predominantly 90% of them are in women. And the other things that we think about are kind of hormonal changes. And so, for instance, in Kara's instance, being just early postpartum period, that's the time that the hormonal changes are kind of the biggest significant changes, and that can propagate spontaneous coronary artery dissection in certain patients. And also the postmenopausal period is also the other time to be mindful of. So the 45 to 55 range, particularly in women, is the time to be mindful of.
Boy, the times in your life when you're feeling the most fragile and the most emotional as well are the times that we need to be on alert. And I want to talk about the fact that Kara had a new baby at home. So, and Kara, you touched on this. We know cardiovascular disease is the leading cause of maternal death in the U.S. It's responsible for more than a third of all pregnancy-related deaths. We know from what Dr. Roldan said that what happened to Kara could be related to having just given birth. So how common is it in your patients for you to see this?
In my patients, I would say it's still very uncommon. So again, it only accounts for less than 1% of myocardial infarctions in the US, but it's within that early postpartum period that I do tell my patients as a cardiobstetric physician that please listen to your symptoms, because that's also the time period that people are most prone for postpartum cardiomyopathy, which is heart failure in the postpartum period. So I always emphasize to not ignore their symptoms, because those symptoms are really valuable, and to seek medical care if they're experiencing things that they don't think is typical after a postpartum period or within that late stages of pregnancy, which is, again, when there's a ton of hormonal changes occurring.
And for our viewers who don't have MDs or are nurse practitioners, myocardial infarction is?
Heart attack.
A heart attack.
Yeah.
Okay.
A heart attack.
So when you hear that, it's the same as a heart attack. We love getting our viewer questions. We want to answer every single one of them. So be sure to send them to us on YouTube, Facebook, the X platform, and the All Things Heart email. The links are there on your screen, and we will connect with you in real time and answer your questions. So let's get straight to one that came in from our Facebook viewer, Jean Raridan. Jean would like another explanation of how it was repaired in Kara's body. Dr. Roldan?
Yeah, great. So as I mentioned, typically when we see spontaneous coronary artery dissection, it really depends on the patient scenario. So if someone is extremely ill, nearing cardiogenic shock, or profound heart failure as a result of the heart damage that they've experienced from the heart attack, then intervention is typically recommended. If someone is experiencing some discomfort, but they're still seeing good flow, and they're not seeing an acute occlusion or acute closure of the lumen, typically the recommendation is to not intervene or to not put a stent in. And the reason why is because you can worsen the propagation of the dissection, so that it actually makes the scenario worse. And so typically, in Kara's case, again, very, very acutely ill, very occluded artery, and it was also one of the main arteries, and it was very proximal, meaning at the very beginning of the artery. And so without intervention, she would have experienced a lot of damage.
So how did you get in there? How did the team get into that area?
Yeah, so they did that through what we call a coronary angiogram. And what that is they stick a catheter through either the wrist artery or through the groin artery, and they take that catheter all the way to the heart arteries. They inject dye into those arteries, and that's what we looked at on those images, was dye that was filling those arteries.
Okay. And do you obviously you remember, did they go through your wrist or your groin?
They went through my groin.
So when you woke up, were you sore?
Yes. Yeah, and bruised. I got a little bit of medicine during the procedure. I don't remember a whole lot of the procedure.
So are you in a twilight?
I'm kind of in a twilight. Okay. They gave you a little pain medicine, a little medicine just to relax me, and so I don't remember a whole lot of it, but I do remember being on my back, flat on my back to recover, and having pain in my groin from where they had gone in.
Do you feel like having a medical background made you more afraid because you almost know too much?
I think, yeah, it's to some degree, yes. I was even more panicky about what was going on because I knew what was going on.
Right, where it's almost better to it's almost ignorance is bliss sometimes.
Yes.
Dr. Roldan, we're getting so many questions from viewers who just want to keep talking about how common this is in women. We have Peg Brash, who asked about, is this specifically associated with postpartum? I think you said yes, it is, correct?
So it can be. Okay. We don't understand, and I wish we did, but in medicine, it's always nice to say we still don't know why, but there is some hypotheses that suggest that sex hormones, particularly progesterone and estrogen, play a significant role in the pathogenesis of SCAD, but the reason why and to what degree is unknown, because we've got a lot of pregnant women who don't have spontaneous coronary artery dissection after giving birth. And why it happened in Kara after her fourth child rather than during her first, second, third child, again, we still don't know why or to what degree the sex hormones can impact, but we do know that SCAD is more common in that time period as well as in the postmenopausal period in women than in other times of their life.
Couple different questions about men versus women. We have someone who wrote in asking if men can have SCAD, and then Jeremy Yenser, another Facebook viewer, wants to know, is it more common in women or men?
Definitely more common in women. So about 90% of cases are in women.
Oh gosh. 90%.
But that does still mean that 10% of cases can happen in men.
And would the symptoms be the same in men?
They typically are. So, and notoriously, women and men have different types of symptoms, but they typically are neck pain, arm pain, back pain, chest pain, shortness of breath, nausea, diaphoresis. Those are typically the symptoms that patients can experience.
And is there a time in a man's life that it would happen more often? We talked about menopause and right after you deliver a baby for women. What about guys?
Yeah, so the epidemiology would suggest that it typically happens between the ages of 35 to 55. And so that is probably the time period that it also happens in men as well.
Tim has a question for Kara. Tim wants to know if anyone else in your family that you know of has ever suffered SCAD or a heart attack.
No, I have no history. I mean, my grandma had heart disease, but it was at the age of 80, and it was typical blockages from plaque or cholesterol, nothing spontaneous like I experienced. We have a couple different women who've been asking, Ashley and Julie and Ann actually all want to know what life was like afterwards and when could you hold your baby again? You said your husband took over the heavy lifting, of literally the lifting. When could you start doing more of the physical stuff? Luckily he was still pretty tiny, and so I had a brief weight restriction, but he was still tiny enough that I could hold him. But a lot of times my husband or my older daughter would bring him to me if I was on the couch, just so I wouldn't have to get up and do it. But it took several, probably it was in May, and probably by the end of the year I started feeling a little bit more normal and kind of back to being a full-time mom.
So 7 months out. So you just had to give that time. This conversation is fascinating, and I thank you for being so open about what happened to you, because you are going to help so many women and men, Kara, who are struggling with a sudden unexpected health event that happens, who are feeling the blues or in the weeds or just overwhelmed, and you're an example of how you get through it. You just got to give yourself time.
Right.
What would be your message to other people out there who are watching this? And also I want to ask, what does it mean to be working alongside the very doctor who's treating you, but you guys are you ladies are co-workers?
Yes. Yeah. Well, in terms of working with Dr. Roldan, I try very hard to keep a patient-doctor relationship and go through the proper channels if something is not right or something, and I need something or have a question, I think I try to do really well leaving my personal questions for my visits with her and try to stay very professional.
That would be really hard to have your cardiologist in arm's length away. I would want to ask. I'd be bugging you, Dr. Roldan, honestly. So that's wonderful. What's your message to women watching?
I think the biggest message is to listen to your body and be your own biggest advocate. You know if something's not wrong or not right, and you know if something doesn't feel right, and to keep pursuing answers until you get it and get the problem fixed. Because I think a lot of times, especially younger women, don't always, you can chalk it up to sleep deprivation, anxiety, just overall fatigue and being overwhelmed. And I think, when something's not right, you need to keep pushing to get the answers.
There's so many reasons to feel rotten when you're going through menopause or you're a new mom. So you've got to really listen to your body.
Yes.
Dr. Roldan, what would be your message to people watching, particularly women who might be pregnant, have just delivered a baby, or have just gone through menopause?
Yeah, and I know that we've spent a lot of time talking about women and those type of inciting triggers, but I would be without it would be a disservice if I didn't mention other type of inciting triggers or physiological stress. And so I think the other thing, apart from the patient population that we've emphasized enough about postpartum and post menopause, is other emotional stressful triggers or physiological stress. So heavy lifting, of extreme vomiting, a lot of coughing, or even the use of some stimulant medications or illicit drugs. Those are other triggers that can also cause spontaneous coronary artery dissection. And those who have other type of inflammatory disorders, so lupus or celiac disease or inflammatory bowel diseases, or collagen disorders like Ehlers-Danlos, or Lewis-Dietz. These are all types of triggers, physiological triggers, as well as thinking about emotional triggers that can result in spontaneous coronary artery dissection or puts you at higher risk of that. And so apart from the group that we've emphasized, I think keeping in mind that it's not just in the postpartum and just the postmenopausal period, it's really can occur, in these other type of emotional and physiological triggers. And so as Kara alluded to, make sure you listen to your body. Don't cough it up to, it's just anxiety. Or even if another physician tells you that we think it's anxiety, it's always okay to seek out a second opinion as well if you're concerned.
Oh, absolutely. Second opinions have saved the lives of so many patients that we feature on this program. And we love sharing the incredible work of our doctors here at the health system, like Dr. Roldan. We also love showing you what life looks like for them outside of the hospital walls.
Now for a secret look into the guardians of healthcare at the University of Kansas Health System, let's go behind the mask.
Dr. Roldan, you shared some beautiful pictures. Who is the handsome guy with you?
Yep, that's my better half. That's my husband, Sawyer Askren.
Your hubs. And you guys big Chiefs fans?
My hubs. We are. And that's Jenny. She's another nurse practitioner that I work with. We play soccer together.
I love that. How common is it to play sports and socialize with your coworkers?
I think it's you make it you can make your work-life balance as you want, and I feel like I've got a really good work-life balance here at KU. And so I work with Jenny and Kara, and I play soccer with Jenny mostly every other weekend.
Oh, that's wonderful. Well, we love having you at the health system, and thank you so much for taking the time to be with us today, Dr. Roldan. And Kara, thank you for sharing your journey. You will help so many